Joining me on the line now from Avive Clinic, Mornington, Peninsula, I have Megan Deutsher. Good morning, Megan.
Good morning, Rachel. How are you?
Very well, thank you. Now, you're here to chat to us about let's see here, Avive's first stage inpatient program that helps adults stabilise, rebuild routines and learn practical skills before stepping down to the day programs. Now, you had a hand in creating these foundation programs along with the co-founder Matt McDormand. Have I got the right name? Let me have a look. There he is. Fantastic. So who better to talk to than the one who has created them? So tell us all about it, Megan.
So we'll start with our foundations program, which is essentially the first stage of Avive's four-stage therapeutic journey. And essentially, the foundations program is a set of structured programs and activities that are delivered over our 21-day inpatient stay. And they're really designed to help patients not only manage their symptoms, but learn to live again. So patients during this time actually participate in two structured programs. The first of which is our unique in-body program, which we also chatted about last time. And this is where we use movement as a way to reconnect the mind and body. And the second program the patients do is one of the two focused therapy streams. So either the anxiety and mood disorders program or the dual diagnosis program. And this program is for patients with coexisting mental health and substance use concerns. But during this time, their timetable's filled with a range of other electives as well. So they participate in mindfulness, art therapy, diversional therapy, nature walks. We've got yoga and guest speakers. And together, this collection of programs really forms the foundation of the patient's mental health journey, and it actually provides them with the basic skills on which they can then build and heal from trauma in our later stages of our programs.
Okay, so very all-encompassing and, as you said, the foundation. And I like to, when we had a little chat yesterday before you coming on, how mindfulness isn't meditation. Now, that stuck with me. Tell us a little bit more about that.
So mindfulness is a really important aspect of the foundation program and actually of life, really, and it's the first skill that we learn. So, for example, many people managing their mental health, it's really difficult, largely because we live in a rush and we actually have no idea what we're thinking or feeling. So, Rachel, if I may ask you a question, have you ever driven the kids to school and arrived only to realise that you have no recollection of ever getting there?
Well, when you're stressed and trying to be on time, absolutely. You're on this automatic pilot, I know the way, and then you just go. So, yes, absolutely can relate to that.
And so that's exactly what we do. We live on this autopilot. And when we live like that, we have no idea what we're actually thinking or feeling. So how are we actually supposed to manage our thoughts and our feelings when we don't really know what's going on for us? So mindfulness is not meditation, but meditation involves mindfulness. And what that means is, in order to understand who we are and what's going on for us, we need to bring ourselves to the very present moment, as in what's going on right now. And that's actually mindfulness. And that's the very first basic skill that we actually teach in the Foundations program.
Yeah, look, if you read any of the gurus and their advice, it's always to stay present, isn't it? Be in the moment. Don't be thinking, what's coming up, what's happening, or don't be stuck in the past. Oh, no, I wish I didn't say that.
And people with trauma, that's exactly what actually happens. They're either stuck in the past ruminating, and so when they're reacting, they're not actually reacting off what's going on in the present moment. So they might be having a fight with a partner, but they're actually reacting to a historical event. Or people with anxiety might be worried about the future, like something that hasn't even happened yet. So we really need to bring ourselves back to the present day. So when we're reacting, we know it's off what's actually going on in front of us and not from the past and not from the future.
So it sounds to me like a way to learn to be the best version of yourself. So to understand, why am I having these thoughts and what past patterns are triggering this? So it sounds like your foundation program is really to establish that, helping people understand themselves.
Yeah, absolutely. And that's only the first step of Foundations. And on top of that as well, it's not enough. Life needs to be more than just existing and managing your thoughts and your feelings. So life is full. It's about relationships and work and hobbies, social connections. And last time we talked about the importance of movement and nutrition and sleep. So Foundations is really a whole package which helps patients also reconnect to their values to find meaning and purpose. So ideally what we want them leaving with is a safety toolkit, self-awareness to understand their thoughts and their feelings, but also a roadmap on how to manage their relationships and work and hobbies and just life in general.
Yeah, no, definitely. I know it's always good to take a little time for yourself. And I know I always reflect, especially if I behave badly. It's like, now
Yeah.
or mainly the thoughts, now where did that thought come from? Because that wasn't very nice, Rachel. So,
And that's what happens, Rachel. So with our 4-stage therapeutic journey, this is the foundations and the basics, and then we go on to actually learn where that actually comes from. Because a lot of the stuff is in our core beliefs from childhood. And sort of to move through trauma, that's what you actually have to get to eventually.
I did an exercise once that I loved. They picked any subject or an item, excuse me, and then everyone in the room said what that brought up for them. And it was fascinating. It was so diverse, so different, and I found that really interesting.
And so that actually brings a good point about foundations and why it's really important to start with foundations, because when you do talk about the past, it is going to bring up emotions that haven't surfaced for a really long time, and that can be really almost re-traumatizing if you don't have the skills to manage those emotions that are coming up. We need to actually be able to tolerate distress and negative emotions. And so in order to go on and heal from trauma and go back into the past, we need those foundational skills that will help us manage those emotions.
And that's why all the experts down there at Avive are there to guide people, because clearly this is big emotions they're dealing with. So you can obviously support them while they're going through that.
Absolutely. That's what we're there for.
Who is this targeting? Which age group, or who can go down and receive treatment?
So this is the biggest misperception in society, I think. So Avive is for anyone 18 plus. But I think there really exists a stigma around mental health hospitals. And I'm sure people out there still think that it's one flew over the cuckoo's nest only for acute psychotic patients. And I know we laugh, but I truly still believe that we haven't really moved past the stigma of mental health and seeking treatment. And it's not selfish to seek treatment, it's actually self-care. And so Avive is really more like a wellness retreat, and it's not the psych wards on TV. And I think a lot of listeners and yourself would really be surprised at the vast array of patients we actually see. We see young mums drinking too much to really complex PTSD cases. And I think one thing that COVID taught us was the importance of social connection. So what we're seeing now, though, is a lot of young adults presenting with anxiety and depression with increased substance use. And I do lovingly refer to these young adults as the COVID kids. So if we think about young adults, they were 16 to 18 when they were locked up for 2 years. And imagine all those developmental milestones that they lost. And now they're presenting with a lack of sense of self and worth. And so Avive is the best place for these young patients to come in to learn to manage their anxiety and depression, but it actually gives them space to work out what they want to do with their lives. We don't need to wait till we're in an acute psychotic state to seek help. And I think that's one of the biggest things and the messages we need to get out there.
I felt for that age group. There were certain ones during the COVID lockdowns that I thought had it a little bit tougher. And I know it was tough for everyone. However, I thought those ages, such big emotions, and that time in your life when you want to be with friends and socialising, and that was taken away from them. So I can understand you calling them the COVID kids for sure.
Yeah, I know. And we talk about, we just spoke about before about finding yourself and learning to live again. Well, they're the kids that need to do that as well. And at the other end of the spectrum, we have grieving older adults who have lost their partners. We have retirees with anxiety and depression. The other cohort is also women going through menopause. I'm not sure if you've seen TikTok or whatever else, but there's a lot of memes that happens around menopause. But I think while hormones play a large part of that, it is a really significant part of life that is really, really hard for people. And I think sometimes we just brush it aside as a part of life. And perhaps, women going through menopause, if they've got their hormones sorted out and things still aren't going right for them, if there's increased substance use or relationship breakdowns and struggles with the kids who are actually now the COVID kids, I think we need to have early intervention. It's way better to come in now and to seek some time out for yourself and give yourself that space to work out what you want to do in life again. So I think Avive is really an opportunity for self-care for anyone 18 plus.
Yeah, definitely. And I think you're right. It's not the stereotypes. It's not the severe schizophrenia, and it's not what you'd expect. To me, it did feel very much more like a wellness retreat. and a place to give yourself some much needed self-love and tools to live your best life, because life is fun and adventurous and there's things to be had. So if you're feeling any strong emotions, whatever age, over 18, just talk to them and see, it might be the perfect fit. And your intake process, I think we'll close with that. How easy, and of course a good tip from you, but how easy is the intake process?
Well, it's really referral by a GP or psychiatrist or self-family inquire to our intake. So via 1-800-284-830. So if any of the little scenarios I just said resonated with anyone, just give intake a call. We can actually help out to figure out whether, it's a suitable admission or not. It is really that simple. And my actual tip is actually to try and learn mindfulness. And it's probably the one thing I have struggled personally with over my time. But really, if we just try and take 1 minute out for the day, it actually really can help reset your nervous system and bring calm to your day.
You think 1 minute would make a difference, Megan?
Absolutely. Do you stop for 1 minute a day? Just 1 minute. It's actually a long time if you actually just stop for 1 minute and come right back into the present moment to think about what you're thinking and feeling and just breathe.
Wow, 1 minute. Okay,
1 minute.
Listeners,
give it a go, everyone. 1 minute a day.
Excellent. All right, we've been talking to Megan Deutsher down there at Avive Clinic, Mornington Peninsula, which you'll find at St. John's Lane. See, it's all in the healing, isn't it? The saints are looking after you down there. Well, thank you, Megan, for your time.
Thank you very much, Rachel. Lovely to chat again.
Yeah, you have an awesome day. Okay, bye.
Thank you. Bye.